You're listening to the Conversations with KidsPeace podcast. Advice, information, and inspiration from experts at the leading provider of mental and behavioral health services for children, adults, and those who love them. Now, here's your host.
Hello, and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin. The latest issue of KidsPeace's Healing magazine shines a spotlight on the impact of the COVID-19 pandemic on mental health in America. And the lead article proposes a new way of looking at mental wellness activities based on the experience we gained from the early days of the pandemic about the need for personal protective equipment. And to discuss that, we welcome back to the podcast Dr. Matthew Koval, Executive Vice President and Chief Medical Officer of KidsPeace. As always, great to talk to you, Dr. Koval.
Same here, Bob. It's good to be with you.
All right. You and our good friend Jody Whitcomb co-wrote an article that's the lead article in Healing Magazine this time around. And in it, you raise a really important point about the difference in the kind of stress that we face now as compared to the early days of the pandemic. Can you explain why what we're feeling may have changed?
Sure. I think when we first saw the pandemic hit us, I don't think anyone had the knowledge that this was going to turn into a long-term event. I think the thinking was, this will be something that we can get through in a few weeks or a few months, and then things will, quote, return to normal. And what we found is that this is really a long-term traumatic event that's happened to all of us that we're all sharing. So a way to think of it might be, if you live on the coast and there's a hurricane, that hurricane comes on a Thursday, and then by Friday, Saturday, things have kind of settled down, the weather's better, and people are out dealing with the cleanup, and they've sort of already experienced the trauma, and they're starting to move on. But the pandemic has really turned into like a hurricane every week or every day. It's just happening day after day after day. Another analogy would be like a war-torn country where there's just war that has occurred in some of the Middle Eastern countries, for example. War has occurred for years and years and years at a time, and the trauma never actually subsides. So how people respond to that trauma actually changes when it changes from an acute trauma to a long-term trauma.
Those are really good, powerful analogies. And the core of your article is another analogy, that being the need to treat our mental wellness with the same care that we addressed physical health with personal protective equipment, or PPE, which is the acronym we all know now. So what are some of the similarities that you see between our experience with PPE and what you're calling in the article mental health protective equipment, or MPE?
Well, it's very similar, right? We wear masks, we wear goggles, we wear gloves to protect us from the infection that might occur, not just from COVID, but all kinds of things. If you work in healthcare, people will wear protective equipment for things like tuberculosis and other infectious types of diseases. Whereas we didn't spend a lot of time thinking about, well, how can I protect myself from the traumatic experience that I'm going through? And because we've just established in your last question that the pandemic has turned into a long-term trauma that's kind of keeps coming day after day after day with, frankly, not much end in sight, we also can use different techniques to prepare us mentally so that we can remain as healthy as possible while we're dealing with that long-term stress. Again, very similar to using a mask to stop yourself from getting infected. You could use another mental health tool to help you deal with that long-term stress.
And in the article, you identify 5 areas of behaviors that are the tools of MPE. You call them in the article the toolbox of MPE. And I'd like to talk through those if we can, each one of those. The first one we're going to talk about, I would say, seems to be the center of all good health discussions forever. And it has to do with sleep and nutrition.
Right. And again, it's very self-explanatory. You need to keep yourself rested, and you need to keep yourself well nourished in order to deal with anything that's stressful. So folks will find themselves having sleepless nights, and then of course you notice the next day you're not handling things as well as you used to. as we've had to deal here at KidsPeace with our associates becoming ill, our family members, even some of our clients, it's really hard not to let that affect your sleep and your nutrition. But the problem is, of course, when it does start to affect your sleep, then you're less able. It drains your battery to be able to help the people that it is that you're trying to help, or to be able to care for the people that you love in your family. So it's kind of like, protect yourself so you can protect others. Or like when you're in a plane, they always say put the oxygen mask on yourself before you put it on the person next to you. And there's a reason for that.
Now, the second area you talk about are positive coping skills. Can you give us some examples of those?
Sure. I mean, things such as using humor that might help you get through some tough times. Things like engaging in activities that you really enjoy, or even picking up a new hobby. We're all spending more time at home than perhaps we have in a long, long time because of stay-at-home orders and the fact that various social venues are no longer open to us. So maybe it's time to, hey, pick up that guitar that you used to play back in college, do some singing, play board games with your family, do some things that you haven't done before. And also you can do things outdoors that are more solitary or smaller group activities. Take a walk, do some exercise, pick up a camera and go. Everyone's got a camera on their cell phone. Go take pictures. Do something that gives you some interest and kind of keeps you away from dwelling on the same stressful thoughts time and time again.
And I love in the article, by the way, that you make the note of when you're doing some of those artistic things or those things that tap into some of those areas, you don't necessarily have to be good at them. And I certainly am not. It's the idea of doing them that's so beneficial for your mental health. I have to go to number 3 because I think number 3 is one that's going to be extremely popular with everybody who's watching, a lot of folks nowadays, and that's limit your exposure to media. Why is that valuable?
Well, look, those of us who are into social media, in addition to watching television or reading the news, you'll see that you sort of find yourself in the same bubble all the time. And in fact, the same themes tend to be repeated over and over again. Many people don't know this, but the programs like Facebook, Twitter, Instagram, some of these other very popular social media platforms, they actually have built-in algorithms that specifically give that person the same stuff they're interested in over and over and over again, literally keeping them in a bubble. So if you're finding what you see in your news feed as stressful, well, you're just going to keep getting fed the same stuff over and over again. And so sometimes my advice is turn off the device, turn it over, put it down, and again, do something with your family. Do something to connect to people. Go outside, do the things that we talked about in the last point. But staying in that bubble can become really quite unhealthy.
And I know in the recent election, heard a lot of folks talking about the fact that they found themselves refreshing their browsers over and over and over again, like seconds, and to see if there were different items. And in some ways, you have to say, walk away, just take time. The news will be there when you get back, and I think that's extraordinarily helpful. Speaking of helpful, the fourth area.
If you don't mind, Bob, I just wanted to say, along with that same point, I noticed the same thing. I was watching election coverage, and you're watching it, and then I sort of realized after a while, and I put some time into it because I was very interested. And then after an hour or so, I realized they're just saying the same things over and over, the same things they said last hour. And you know what? I turned it off and walked away. I don't need to hear the same things over and over again.
And as you say, it's not just annoying, but it can actually be detrimental, and it's important to be aware of that.
Right.
The fourth area I want to get to, because I think it's something that a lot of people don't know, but they don't look at it in the way that you and Jody talk about it, and that's helping relationships. Now, what do you mean by that?
Well, a helping relationship is anyone that's in your orbit, or even not in your orbit, but you need to get in your orbit. People who support you, people who give you strength, people who again, I talked earlier about decreasing your battery. These are people who help pump up or charge your batteries. So again, all of us are spending more time isolated because of the pandemic. So you can reach out to these helping people through Zoom or some other kind of video, FaceTime or other kind of video conferencing platforms, or just by telephone or email. But also people who have helping relationships or people in our field, right? People who are counselors or therapists who you may need to reach out to get the help that you need. And we definitely want to encourage people now, maybe more than any other time, that if you're finding yourself really struggling, it is absolutely time. There's no shame in reaching out and saying, hey, you know what, I need some help. And maybe it's someone in your family, or maybe it's for your son or daughter, it might be their teacher or their coach, or for your family or you, it might be reaching out to a counselor or therapist.
And that leads right to your fifth and final area, and that's access to mental health care and services. You seem to be advocating in the same way that we talked about how we want to make sure that we're stockpiling PPE, that folks make a plan on how they would seek help should it become necessary. How do they do that?
Well, one of the quick things you can do is, if you have insurance, either that you've purchased on your own or through your employer, you can look at the back of the insurance card. There should be a number to call where you can look for providers that are in your network. You can also go to your insurance company's website and find the exact same information. Outside of that, many places where folks work, there is an employee assistance plan that you can have access to. If you're not working right now or don't have insurance, you can look for counseling at your place of worship. There certainly are community clinics where they look at folks without insurance and help them work through a sliding scale or some other kind of way to make sure that they can get the help that they need. Your child may be able to get help at their school. And then there are things like the National Alliance on Mental Illness. They have a website and a helpline where you can go and get information about how to get help for you or your family member.
I think it's so important, and we talk about this obviously all the time here at KidsPeace and on the podcast, that help is available. Help is out there. Don't feel like you're alone, and don't feel like you have no idea what to do. Just, there's a lot of ways to do that. I do want to mention that for folks that are in the Lehigh Valley of Pennsylvania or the Pocono area, KidsPeace's outpatient offices provide free walk-in assessments for folks who might be going through crisis. And that, as I said, it's free and it's no appointment necessary, and they can take advantage of that. They can go to kidspeace.org and look up our outpatient services for that. So I wanted to make sure to get that in there. When you close the article, the ending of your article has a really, I think, important point that really struck with me, which is you indicate that maybe the experience of dealing with COVID-19 actually has a silver lining. How so?
Well, I think as people realize, maybe people who haven't had a lot of stress in their life, or certainly a stress that's lasted for as long as the pandemic has lasted and will last, that they might gain a better understanding of what it is like for folks who have had major stressors or major traumas in their life. So I'm hoping that people will gain a better understanding of what folks who have emotional and behavioral challenges really go through. In addition, I think it helps people learn that there is a connection between what's going on physically and how that affects us mentally, right? So anyone who's suffered with COVID, they've dealt with the stress of the illness, they've dealt with the worry about, am I passing this illness to other people I care about? They've dealt with the stress of, is this going to get worse? Is it going to affect my long-term health? So there's that connection of something that's happening physically, and then how you deal with that mentally. And finally, I'm really just hoping that people really get from this that patience and tolerance of one another is so necessary right now. I'm sure we've all seen videos on social media of the people who've gone into a store and kind of lost their mind because they were asked to wear a mask, or they got so upset because somebody said something about their favorite candidate that they didn't like. And I just feel that that's really not helpful to any of us. And I think as human beings, we really need to work on trying to increase the amount of kindness, tolerance, and the willingness to look at other people's point of view and to help one another. And if anything comes from this, we've certainly seen tons of examples where healthcare providers and regular ordinary people have really gone the extra mile to help their fellow man. And to me, that fills me with a lot of inspiration.
Well, you know, because you've been on here before, Dr. Koval, that we always ask our guests for a life hack, something. And I'm going to just make a host's ruling of saying that was the perfect life hack. More tolerance, more patience, more understanding where people are going. I don't think there's anything more inspiring to do that. So we thank you for bringing that up. Dr. Matthew Koval is Chief Medical Officer of KidsPeace. The article that he and Jody Whitcomb wrote on the need for a mental health protective equipment toolbox is in the fall-winter 2020 edition of Healing Magazine, which is available now at healingmagazine.org. Check out the other articles and features. You can also get a special graphic of the MPE toolbox, which we've created, and it's something that you can print out as a reminder to take care of all of your health needs, physical and mental health, as we as a society continue to cope with COVID-19. All of that can be found at healingmagazine.org. Dr. Koval, as always, thank you for being with us.
My pleasure.
I'm Bob Martin. Thanks to all of you as well for joining us, and we hope to have you join us again for more conversations with KidsPeace. Take care.